Well, joining us to kick off the conversation today is Dr. Rick Boone. He is a licensed clinical psychologist and the clinical director with Warriors Heart. Welcome, Dr. Boone.
Good morning, Sherry. Nice to be with you this morning.
Yeah, absolutely. Glad that you can kick off this important conversation with us. Before we even get all into the topic, we know we have a lot of ground to cover. Tell me a little bit about Warriors Heart and the population that you serve through that organization.
Thanks, Sherry, for giving me this opportunity to be with you and to share a little bit about Warriors Heart, which is a treatment facility. We like to refer to it as a training program for the warrior class, meaning military, active duty, and reserves, firefighters, police officers, emergency medical technicians, those people who've been on the front lines defending us either in our communities or overseas. And we help them recover from co-occurring disorders, psychiatric or behavioral health disorders such as depression, post-traumatic stress disorder, and also addictions, primarily alcohol use disorders, but also other substances.
And so given that May is recognized as Mental Health Awareness Month, it's a time that we in the media and other organizations, we place more heightened awareness on mental health. But overall, there is still a stigma, unfortunately, tied to folks that are actually seeking treatment for behavioral health issues. How do you address that?
Well, Sherry, you're absolutely right. And I think it's been as long as there's been mental illness, there's been a stigma attached to it. And, you know, if you look at the word stigma, which means a mark of disgrace, it's particularly unfortunate as applied to people with behavioral health or mental illness issues, because it's not anything that they've done. It's a condition that they have. It's a disease. And so just as we've overcome certain stigmas attached to physical illnesses, we still have a ways to go in overcoming the stigma that's attached to psychiatric problems. And those stigmas can come from society, people who are afraid of the mentally ill. They feel like they may be dangerous or they're so different than we are, which is an unfortunate myth. And it also comes from the self. You know, people themselves who have the conditions sometimes feel that they are other than the rest of us, and it creates isolation, loneliness, and even despair.
Absolutely. And then one of the things that we know, Dr. Boone, that's come out of the pandemic is that we're opening up about a lot of things, you know, from finances to back to mental health, how this whole crisis has really affected us. We've seen celebrities that have come out and been very open and public about their private struggles. Do you think that's been good for pushing this dialogue forward?
Absolutely. So, you know, there are three essential ways that stigma can be combated. Perhaps the most important is education, just teaching people what we think that they should know with respect to the mentally ill. Another is protest. And so in a sense, the celebrities are on the front lines of that protest. We don't want to be ostracized any longer. We don't want to be discriminated against. We don't want there to be a prejudice against the mentally ill or those who experience addiction. And then finally, it has to do with contact, actually being with those who are experiencing depression, anxiety, post-traumatic stress, and realizing, look, they're a lot like we are. And as a famous psychiatrist from the early 20th century once said, we're all more human than otherwise. And that's certainly true for the mentally ill and those who suffer from substance use disorders. They're a lot like the rest of us. And if we have contact with them, that's what we'll find out.
You know, and that was going to lead me to my next question. Is it, you know, as you are certainly a licensed clinical psychologist, is this more just being human? Because I know in work settings, we sometimes say, oh, I need a mental day. But is it just more of being human? We go through, you know, peaks and valleys in our life experience. So is this part of the process? Will we characterize it as being mentally ill, or is it just, hey, you just need a bad day and you need a day on the beach?
Sherry, that's a great question. I think it can be both. And I think, you know, the behavioral health profession identifies certain conditions as adjustment problems, life circumstance problems, which can lead to changes in our emotions and the way we think about ourselves and our relationships. But let's face it, there are other factors at work biochemical factors that create bipolar disorders and schizophrenia, and that is a separate category. That's a disease that requires specialized treatment.
Absolutely. Well, and Dr. Boone, throughout this whole pandemic, and as you say, you work with those that are on the front lines, tell us what you have seen in this profession as we hopefully get back to normalcy at some point in time. But what have you seen as you're working with these frontline workers?
Well, certainly the pandemic has affected both that population and the rest of us as well. Isolation is the big problem, Sheri. People who can't interact with their fellows, especially in the world of addiction, where recovery is so much based on the fellowship of the anonymous movement and other fellowships of recovery. When people are isolated and can't interact with one another, they're going to return maybe to the substances that give them comfort. And those substances, of course, will eventually destroy them if they're not careful.
And in the time that we do have remaining, Dr. Boone, are there some resources that you would lead our audience to? Is there a website, or are there some online resources that people can get some more information about?
Yes, there are. And for those who are part of the warrior class, retirees who may not have heard of Warriors Heart, it amazes me. This is, the world's #1 healing center for the warrior class, and yet many people don't know about Warriors Heart. We're situated in a small town in Texas, but I would recommend that they go to the Warriors Heart website for one. But the National Alliance for Mental Health and the National Health Institute has a mental health branch. These are also, clearinghouses for information. And there is always the crisis line that people can use. 911 will put you in touch with some behavioral health professional who can get you to that next level of care.
Absolutely. Well, we want to thank you, Dr. Boone, for starting us off on such an important conversation for this segment.
Sheri, it was my pleasure. Thank you so much.
Absolutely. Have a great day.